Welcome to Sunday Morning with Trevor Phillips. This may be the week the Labour government goes back to the future. The Prime Minister declared that the operations of the National Health Service would once again be in the hands of elected politicians rather than professional hospital managers. That echoes the famous declaration by Narendra Bevan when he launched the NHS in 1948. If a maid dropped a bedpan in a hospital corridor in his hometown of Tredegar, the noise would reverberate around Whitehall. This morning, the Health Secretary's told newspapers that the abolition of NHS England is just the beginning of Minister's plans, to coin a phrase, to take back control from what he calls the bloated bureaucracy. And if that wasn't enough to be going on with, the Prime Minister's got his eye on the benefits paid to people who can't or won't work, in some ways channeling the spirit of Keir Hardie, the Labour Party's founder, after whom he was named. Hardie's maiden speech in the Commons was all about getting people into work. Back in 1893, he argued that the country should rely less on importing immigrants and put what he called loafers and criminals to work. Then as now, immigration, welfare, even overseas aid divide opinion in the Labour movement, including, we are led to believe, within today's cabinet. There's no risk to the government's majority, but with a crucial by-election and local elections just weeks away, grumbling on the backbenches is the last thing that Number 10 needs right now. Let's start this morning with the government. A little earlier, I spoke to the Health Secretary, Wes Streeting. Wes Streeting, yesterday my Sky News colleague Sam Coates didn't get an answer when he asked the Prime Minister what sort of deterrent would British peacekeeping troops actually be if they couldn't fire on the Russians. Is there an answer?
Yeah, I think the fact that we've not been in that kind of direct confrontation with Russia, there has been a line that has not been crossed since the foundation of NATO. And what we, I think, all want to see at this stage in this terrible conflict is a just and lasting peace that also guarantees the long-term security of the people of Ukraine, as well as their freedom, their democracy, their independence. And that's what the Prime Minister has been working relentlessly to achieve with international allies, trying to bridge some of the occasional gaps and differences of opinion we've seen emerge between some of our European counterparts and our American counterparts.
But in a sense, what is the point? Because Italians have said they're not sending troops. It'll mainly be the British and French. But as far as we know, our position is that we wouldn't ask our troops to fire on the Russians. Now, we know what Putin is like. If our people stand by, he's not basically going to be bothered about them, is he?
Well, I think it would be an extraordinary escalation for Russian troops to find themselves in conflict with British troops. And look, what Thursday is about, where the Prime Minister and the UK are convening military leaders from across allied countries, is about having a serious plan, a serious military strategy to secure a peace. And of course, there's a huge amount of effort that the Prime Minister is heavily involved in to negotiate the peace. So there are lots of moving parts at the moment.
But
it's moving incredibly quickly. And what the Prime Minister has tried to do at every stage is to make sure that we come up with a credible plan involving the Ukrainians that guarantees their peace and security, and Europe's at large, because our own security is intertwined with Ukraine's.
But you use the phrase extraordinary escalation. We're talking about somebody who appears to have no boundaries on what he is prepared to allow his troops to do. So my point is a very simple one. What is the point of talking about peacekeeping when actually, as far as we understand it, the position would be, and the rules of engagement would be, that our troops would not be allowed to engage in, if you like, any kind of hot war, any conflict with the Russians. Vladimir Putin is a kind of person for whom that is simply an invitation to waltz straight past our people.
Well, there are two dimensions to this. There's the peace and then there's keeping the peace. At the moment, the peace is still to be negotiated, but work is underway to prepare for potential peacekeeping. The situation is moving incredibly quickly. Not quickly enough, I think, if you're someone in Ukraine who's fighting for their life and their freedom. But the situation is now moving quickly. The Prime Minister's working closely with international allies to try and make sure that we don't just bring an end to the war, but we secure the peace.
All right. You've written this morning that you plan to get rid of hundreds of the regulatory bodies cluttering the patient safety landscape. For example?
Well, don't want to get ahead of Dr. Penny Dash's review, which is coming to me.
She's the chair of the NHS.
She's the incoming chair of NHS England, but which she'd previously been asked to do a review all of the regulators, of which there are many in the NHS, many of which are working at cross purposes, many of which are trying to do the same thing. And so what I will do with colleagues across government who are also doing similar work is look at how we can reduce the number of regulators, how we can reduce the number of regulations wherever possible to provide the level of clarity for the system, particularly where it concerns patient safety, because if you're clear about what you're supposed to be doing, why you're supposed to be doing it, you're more likely to do it. Simplicity, but also trying to reduce the amount of money we're spending.
But potentially getting rid of the regulators of patient safety would lessen patient safety.
No, quite the opposite, Trevor. At the moment, we have ended up over many years now building up under our predecessor an approach that says if there's a problem, let's introduce a new organisation, a new arm's length body to deal with it, and actually that can breed inefficiency and duplication, and we want to try and streamline that. This week we've announced the abolition of the biggest Quango, the biggest arm's length body in the country, in the world, which is NHS England, because we can see that there is duplication, there is waste, there is inefficiency, not for any fault of the people working in it, but because of the system they are set up to work in. So wherever possible, I want to reduce the amount of money we're spending on things that are duplication, waste, or inefficient, or working at cross purposes.
Well, let's, for viewers' sake, make this concrete. Let's have a look at the list of the biggest ones, the 21 agencies and public bodies that are working with the Department of Health. Any of these for the chop?
Quite possibly, but I'm not...
Come on, give us a clue.
I'm not giving you any new announcements today. I'm working through the consequences of
how many will we come down to then, roughly then,
and I'm not going to do the business of arbitrary numbers either. I think what you've seen this week is our determination to reduce, wherever possible, those things which are not adding value or which are wasting taxpayers' money or not delivering for patients. And in the case of NHS England, what we've had in the NHS for some years now is effectively two headquarters. And if you compare the size of those two organisations combined, about 19,000 people, double what it was in 2010 when we were delivering the shortest waiting times and the highest patient satisfaction ever. So what we're doing by abolishing NHS England is making sure that we've got one head office, a smaller, leaner, more efficient head office, saving hundreds of millions of pounds to put towards the front line, delivering better care for patients and better value for taxpayers.
You said that you wouldn't do top-down reorganisation. Well, to some extent you're doing that now. But I just want to ask you very quickly about something else. Is it right that Jim Mackey, the head of the NHS England, has written to local health boards demanding that they produce plans for a 50% reduction in their spending?
In integrated care boards, yes, with a particular focus on management costs.
Cutting half?
We came, myself and Jim, are confronting a financial planning round for the year ahead where systems returned financial plans to us that would have involved a overspend between £5 and £6 billion before the new financial year has even begun. And I'm afraid this speaks to the culture that I identified before the general election, where the NHS is addicted to overspending, is addicted to running up routine deficits with the assumption that someone will come along to bail them out in a way that, by the way, local councils would never be able to do.
Are you saying that the NHS or the apparatus of the NHS was basically wasting public money?
I think there's definitely examples of waste, inefficiency, duplication, and we're going to go hard at it. Look, even if the public finances weren't tight, and they are, but even if they weren't, I don't think even in the good times it's acceptable that taxpayers' money is wasted, because the money you're wasting could be spent on other public priorities, or the money that's being wasted could be put back into the pockets of taxpayers who would quite like some of it back.
50% cut in spending, how is that different from austerity? George Osborne's word.
Because there is £26 billion more going into the NHS for the year ahead. When you look at the decisions the Chancellor made at the last budget, it was not cutting spending, quite the opposite. So what we're going after is, I'm afraid, some of the culture and practice that's been allowed up in the NHS, which, by the way, it isn't just frustrating patients and taxpayers, it's frustrating for the staff working in the NHS because they can see the waste and inefficiency. They can see the layer upon layer upon layer of bureaucracy and accountability. That's not the fault of the people working in the system. They are also victims of it. And that's why we're going hard at achieving those savings in order to redeploy money into frontline services which benefit patients. Because, Trevor, at the moment, I'm responsible for an NHS that can't guarantee an ambulance will arrive on time. I'm responsible for an NHS where people can't always get a GP appointment when they need one, where NHS dentistry is barely existent in parts of the country. So there are fundamental problems I need to fix, and in order to fix those problems, not only will we put more money in, which we are, but as I've said consistently since before the election, it will be matched with the reform to make sure we deliver better outcomes for patients and better value for taxpayers.
And your central reform idea is what you call democratic control, what most people would say, putting it in the hands of politicians. In practice, aren't you just replacing one large group of bureaucrats with possibly a smaller group of bureaucrats who happen to be under your control, but will probably take twice as long to make decisions?
No, I think it's more fundamental than that. Yes, we want democratic accountability because this is one of the most important public services in our country, and patients and taxpayers deserve to know that when they elect a government, the government will deliver on their priorities. But secondly, what we'll be doing with our 10-year plan is the biggest evolution of power in the history of the NHS, because actually, and this is the difference between political control and clinical control, I actually want more clinicians, more consultants, more nurses. I want them actually driving the reform with more power, more responsibility at the front line, instead of constantly looking upwards to a mountain of accountability.
But in the end, if you're calling the shot, you're taking responsibility.
Absolutely. Well, I was anyway. I mean, I love this idea that because of these reforms, the health secretary will now get the blame. I mean, I was always going to get the blame. What I'd like to do is actually get the credit for doing things that are going to make a real difference, and that's what I'm going to do. I'm not going to preside over a system that I don't think is working. I do want to take umbrage with one thing as well, Trevor. When you talk about, one group of bureaucrats to another, I do just want to make this point that even within an organisational setup that I think needs to go, there are lots of dedicated public servants, and I don't sort of take the view that they're all kind of pen-pushing bureaucrats. They care about patients. There are lots of jobs at risk, and they're decent people.
You said that, but just let me very quickly ask you this. If they're so brilliant and so dedicated and so on, is it wise to go about calling them flabby, as Prime Minister did last week? And in your piece today, you talk about a bloated bureaucracy. Those are the people that you've just called brilliant, dedicated and so on. They're flabby, bloated. What are they?
No, we're talking about the system, not the people who work in it. And by the way, many of the criticisms...
Yeah, but they're going to hear it as them.
There's two things I say. Many of the people who work in the NHS would agree entirely with the criticism I've made about the layers of bureaucracy, about the fact that there is lots of man-marking and duplication between the department and NHS England, which is intolerable and wasteful and inefficient. They'd all agree with that. But will there be lots of people this weekend who are deeply anxious about their jobs and their futures? Absolutely. And I'm genuinely sorry about that, because I don't want them to be in that position. But I've got to make the changes that I think are necessary to deliver better outcomes for
we've got that point. It's 10 days to go before Chancellor makes her spring statement. She's looking for cuts in spending. Can we just get clear? Are personal independence payments going to be diminished in real value, or are they going to be abolished?
We have to wait and see the proposals. I've not seen the full package of proposals yet. And I think what we've had is lots of speculation. No, we haven't had a discussion about the welfare package in Cabinet. But that will be coming to Cabinet.
That's interesting, because everybody's reporting endlessly that there's division in Cabinet, and you've discussed it, and people have been... One lot have said this, and another lot have said that. So you haven't talked about it at all?
Well, sometimes I read reports of Cabinet and wonder if it was the same meeting I attended. But regardless, look, what we're trying to achieve with welfare reform is to make sure that the welfare system does the two things it needs to do. One is to support people who cannot work, to make sure they've got dignity, independence, quality of life. And secondly, for those who can, to make sure that the welfare system isn't just a safety net, but a springboard back to work. We've now got 1 in 8 young people in this country out of work. 1,000 people every day are signing on to personal independence payments. 1,000 a day. That's, over the course of a year, size of the city of Manchester. And we've got to make sure that this system delivers for those who need it most and is sustainable for the long term and provides the right kind of support for the different types of need that exist within that group.
That we've got 2.8 million people, or probably more now, who are receiving benefits because they can't go to work. The number of people who have are claiming benefits because of mental health conditions, it's gone up to more than half a million. Are people being signed off too easily these days?
Well, the system is definitely unsustainable if it carries on growing at this rate. And I think...
Well, that's a separate point. The question, I understand the point about the spending. I'm asking you, though, if the judgments that are being made about who gets welfare benefits and gets signed off work, whether we're now in a situation where it's too easy to get these benefits?
Well, I think there's sometimes a presumption in favour of the benefit system. I'll give you an actual example. A friend of mine, diagnosed with cancer, uncertain prognosis, was told in the conversation, I can sign you on to the welfare system if you want to stop working. And she said, well, why on earth would I want to stop working? I'm to all intents and purposes, able to carry on. I want to carry on. The presumption on the part of the person having the conversation was the presumption that someone would want to stop working. Similarly...
So you want to stop all of that?
Well, I think there's certainly a question about making sure people have got the right support to stay in work wherever possible. That is, and from a health perspective, going out to work is better for your mental and physical health than being stuck at home. There are lots of people out there at the moment who feel trapped in the benefit system because, and this is something I know Liz Kendall is going to address, the Work and Pension Secretary. If you're someone who is in the benefit system, there's a job opportunity available, and you think, I might be able to take the plunge and go for it, you're stuck in this trap of jeopardy because you think, if I take it and it doesn't work out, I go straight back to square one, not onto the benefits I was on before, but right back to applying for the benefits, going through that, what can be an ordeal of applying. So there are lots of things that we are going to do to support people back to work, to provide more security and more of a springboard. So I just sort of say, because we're going to wait until we see the proposals, but it's just important to say that we've seen partial accounts in the media of things that the government might or might not do.
Let me just ask you...
And I think we've got to wait and see the whole range of
Let me just ask you one last question, which is really about the nature of government. Your former colleague, Ed Balls, said this week about the... essentially, the explanation you've just given about what you want to do on welfare benefits, that cutting benefits of the most vulnerable in our society who can't work to pay for defence, not going to work. It's not a Labour thing to do. And you yourself said, by the way, this week that you more or less bragged that you are doing the things that the Conservative Party wanted to do but didn't do. And you said, I bet they're glad that people chose change with Labour. Some of your less favourable friends are saying the change with Labour is that Labour's changing into the Tories.
No, look, I kind of reject that argument. I don't think that it is a Labour argument to say that we would want people consigned to a life on benefit and not able to go to work when we know that they can.
Winter fuel allowance cuts, benefit cuts.
We would also, I think I'd also say that the situation we've inherited in terms of the level of spending, the level of borrowing, the level of national debt, that is not a position the Labour Party is happy with. What we are absolutely doing is trying to reform the state so that it's more effective, get our economy growing again so that we can invest in our public services without hiking taxes and put more money back into people's pockets. Those are Labour things to do. And when you look at the welfare system as it is today, the number of people who feel trapped in it, the number of people who need it and aren't getting the support, the range of support they need, that's why this system needs fundamental reform. And, you know, I have a lot of respect for what lots of commentators, including Ed Balls, have said, but I just respectfully say, People are commenting on speculative reports in the media, not actual proposals.
All right.
Let's wait and see the proposals, and then let's have a debate about whether they're right. But we're determined to make sure people get the support they need to get back to work, and where they can't work, to have a good quality life.
I look forward to that debate. Wes Streeting, thank you very much.
Thank you.